What you should know about arthritis. If the word makes you think about older folks with creaky knees and jumbo bottles of ibuprofen, you need an update. Arthritis now strikes an estimated 20% of Canadians, according to the Arthritis Society. By far the most common type is osteoarthritis, followed by gout, psoriatic arthritis, and rheumatoid arthritis, according to the Arthritis Foundation. There is no cure for any of them, but science has made several breakthroughs in understanding how to treat the inflammation and pain that come with the condition, as well as how to halt the underlying joint damage. The first line of defense: educate yourself. Don't miss this primer on the 10 types of arthritis you could have, and how to tell the difference. 1. X-rays are still the best diagnostic tool for arthritis. You can't see the cartilage wearing away with an X-ray, but you can see the bones touch, which is usually enough to make a diagnosis, says Alexis Colvin, MD, an orthopedic surgeon at the Mount Sinai Hospital in New York City. Indeed, a Washington University study noted that X-rays can diagnose osteoarthritis as accurately as magnetic resonance imaging (MRI), and they do it faster and more cheaply. But remember, just because you don't have it on the X-ray doesn't mean you don't have it, notes Dr. Colvin. Your doctor can do blood tests and a physical exam to determine whether you have arthritis. Identifying it early is key because it gives you time to turn to lifestyle changes before irreversible damage is done to your knees, the most common pain point, or other joints. 2. There's no cure for OA. The customary treatment for OA is non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. The medications don't repair joints, but it can make them less stiff and achy. Though NSAIDs can be effective at getting you through the day, says Kelly Allen, PhD, a researcher at the Thurston Arthritis Research Center, they don't protect joints from progressive damage and may have serious side effects. Using a cane or crutch can make getting around easier without any side effect, says Dr. Colvin. 3. NSAID gels, drops, or patches are good options. When you use a topical, it gets absorbed through the skin, so it has to penetrate far to get to the cartilage, says Dr. Colvin. Topicals may not help as much as oral NSAIDs, but they're good for people who don't want to take a pill, and they have fewer side effects like gastrointestinal bleeding. And research shows they can help. In one study, when people with osteoarthritis used NSAID gels, drops, or patches, half said their pain fell by 50% or more over 12 weeks. Looking for other ways to lessen joint aches? Avoid eating these foods that can trigger arthritis flares. 4. Opioids cause more pain. I would 100% never advise taking opioids for arthritis pain, says Dr. Colvin. Why that's good advice. A study published in JAMA involving 240 osteoarthritis patients showed that those who took opioids were in slightly more pain after a year than those who took non-opioid medication. The researchers aren't sure why, but given that these drugs can be very addictive, they recommend against opioids. Osteoarthritis is one of the conditions that may be treated with medical marijuana. 5. Arthritis boosts your odds for heart disease. Arthritis hurts your heart by contributing to chronic inflammation, reducing physical activity, and increasing NSAID use, all factors in cardiovascular risk, says Dr. Colvin. Researchers estimate that OA boosts your odds for heart disease by 24%. Psoriatic and rheumatoid arthritis raise the odds even higher. 6. Taking the right herbs and dietary supplements can help. Susan Blum, MD, founder and director of Blum Center for Health and author of 2 books on arthritis, suggests several herbal supplements for arthritis. Top among them, boswellia, which can help with pain, and curcumin, which can ease inflammation. Taking them together makes them more effective, so look for a supplement that contains both compounds as well as a fatty acid such as phosphatidylcholine, which helps with absorption, says Dr. Blum. If pain keeps you from getting quality sleep, she suggests taking the supplement right before bed. 7. Cortisone injections don't help in the long term. A single shot can ease pain, says Timothy McAlendon, MD, MPH, Chief of Rheumatology at Tufts Medical Center. But the relief is typically only temporary, and injections aren't a long-term solution. A recent study found that repeated shots of cortisone, a steroid, not only didn't control pain but actually led to more joint damage. Dr. Colvin recommends having no more than 3 cortisone injections over a lifetime. They can be very helpful if someone has arthritis and nothing else is helping, or for someone who isn't ready for surgery, or whose arthritis isn't bad enough to need surgery yet, says Dr. Colvin. But remember, anything you do that's not surgery isn't changing the underlying process of the cartilage wearing away, she says. 8. The jury is still out on other injectable treatments. Hyaluronic acid injections are designed to add more shock-absorbing fluid to joints, but research on their effectiveness is mixed. Similarly, new injectables using your own fat, bone marrow, platelet-rich plasma, or stem cells promise relief, but Dr. McAlendon says the research isn't sufficient to show if they actually work to ease pain and rebuild joints. 9. Insomnia is an undertreated side effect of arthritis. When you don't sleep well, your cortisol levels go up, says Dr. Blum. In other words, you're feeding stress, which can increase the inflammation linked to arthritis. A lack of sleep can also intensify sensitivity to pain, a problem for arthritis patients, she notes. One solution, cognitive behavioral therapy, which helps people change the distorted thinking that can worsen pain levels. The practice has been shown by research to increase the amount of time osteoarthritis sufferers slept, and presumably decreased their pain. 10. New devices might help. A device called CoolLeaf uses specialized electrodes to send water-cooled radio waves into the tissue around your knee, which temporarily deactivate nerves. Patients reported greater, longer-lasting pain relief up to 12 months with CoolLeaf than with cortisone injections. 11. Stem cells could save joints. Someday scientists have programmed stem cells to grow new cartilage on a 3D template shaped like the ball of a hip joint. Using gene therapy, they have also activated the new cartilage to release anti-inflammatory molecules to fend off a return of arthritis. But the stem cell therapy offered for knee osteoarthritis in many clinics isn't yet a proven cure. 12. You probably need more vitamin D. People with low levels of vitamin D are at a higher risk for autoimmune diseases, though Dr. Blum notes that low D isn't the sole trigger for arthritis. Still, it could be one piece of the puzzle and could help. Explains why researchers have found that people with low blood levels of vitamin D, which boosts immune function, are at higher risk for RA. One great free source of vitamin D, sunshine. 13. Early treatment of RA can put it in remission. While there's no way to reverse joint degeneration, getting treated as soon as possible after the onset of pain and stiffness can curb symptoms and prevent further damage. The earlier you treat, the better, says Paula Marchetta, MD, clinical professor of medicine at the New York University School of Medicine and president of the American College of Rheumatology. Unfortunately, a 2016 national survey found that it took people with RA 4 years and visits to at least 3 different doctors to get a proper diagnosis. 14. A shot can stop RA. Early results from one study showed that for people with mild joint aches and high inflammation levels, one shot of rituximab cut the risk of developing rheumatoid arthritis in half. The drug, which belongs to a class of medications called monoclonal antibodies, blocks the production of compounds that trigger inflammation. Rituximab can help put RA into remission and prevent joint damage, and most patients respond well to it, says Dr. Marchetta. 15. Other options for RA. Monoclonal antibodies aren't the only drugs for RA, notes Dr. Marchetta. Disease-modifying anti-rheumatic drugs, DMARDs, decrease inflammation and slow the progression of RA. 16. One size won't fit all. A drug may stop working after several years. Some people have to try several before they find the one that works best, says David Dake, MD, PhD, director of the Rheumatology Fellowship Program at UCSF. We don't know why some medications stop working, says Dr. Marchetta. There's just an individual variation of response. 17. Another option, drugs engineered from human genes. A class of medications called biologics, drugs such as etanercept, Enbrel, golimumab, Simponi, and adalimumab, Humira, are engineered from human genes and are usually an option if you haven't responded to DMARDs. They work by targeting specific parts of the inflammation process rather than suppressing the immune system in general, as older DMARDs do, so they tend to have fewer side effects. One inflammatory target they zero in on is TNF, or tumor necrosis factor, a chemical your body makes that drives the inflammation process in RA, says Dr. Marchetta. Unfortunately, biologic drugs are also more expensive than traditional medications. 18. Try multiple inhibitors. Tumor necrosis factor (TNF) is an inflammatory protein responsible for pain and cartilage degeneration in RA, and drugs called TNF inhibitors can sometimes block it. And if one TNF inhibitor, such as etanercept, Enbrel, or adalimumab, Humira, doesn't work, try another. In a recent study, 43% of patients who didn't respond to one type of TNF inhibitor responded positively to a different one. Here are more findings from new health studies that will change the way you live your life. 19. Or combine them. Almost every patient is better with a combination of a TNF biologic and a drug called methotrexate, says Dr. Marchetta. Methotrexate is one of the most effective drugs to treat RA and is the first drug most doctors prescribe after you're diagnosed. 20. Getting a timely diagnosis can prevent permanent joint damage. In psoriatic arthritis, erosive joint changes can begin within 6 months of first symptoms, says rheumatologist Sergio Schwartzman, MD. But for many people, there can be a 5-year delay in receiving a diagnosis. A growing number of combined dermatology-rheumatology clinics may help reverse the trend. 21. Cherries can lower your risk for gout. Phytonutrients in tart cherries lower levels of uric acid, so it can protect against gout and minimize gout attacks, says Dr. Blum. And in a 2012 study, researchers followed people with gout for a year and found that those who either ate fresh cherries or took cherry extract throughout the year were 37% less likely to have recurrent attacks. Cherries are also one of the most effective foods to fight inflammation. 22. Weight loss. Losing body fat, and belly fat in particular, is one of the best ways you can reduce arthritis symptoms, says Dr. Blum. Belly fat is particularly dangerous because it releases inflammatory chemicals into the body that can contribute to osteoarthritis, she says. And of course, there's the fact that when you lose weight, it lessens the load on joints. The impact of that is important. In a study of 640 overweight and obese people, those who lost just 5% of their body weight over 2 years had lower rates of cartilage degeneration compared with stable weight participants. 23. Get your fiber. You may think of arthritis as being all in your joints, but like many other conditions, there's a big connection with your gut and the billions of bacteria that live there. When the gut microbiome is imbalanced, it can influence inflammation, says Dr. Blum. Which is why fiber is your friend. Fiber is a prebiotic, which means it feeds good tummy bugs while also pulling inflammatory toxins out of the gut, says Dr. Blum. Need more proof? People who ate 22 to 28 grams of fiber per day had a 30 to 61% lower risk for OA-related knee pain, according to a recent study. 24. Swallow some fish oil. Your goal: 3 grams omega-3s, EPA and DHA daily, along with 400 to 500 milligrams of omega-6 GLA. These fatty acids are powerful anti-inflammatory fats that have been found to reduce pain and improve physical function in RA, says Dr. Blum. She recommends eating fish as part of a healthy diet but says to make sure you get enough of these nutrients, a supplement is a good idea. 25. Stay active. Exercise can help stabilize joints and keep down cortisol levels, says Dr. Blum. Just 45 minutes a week of walking or other easy exercise helped people with OA reduce pain and improve joint function in knees, hips, and ankles by 80%. If it's too painful, do physical therapy to get started, suggests Dr. Blum. Here's what happens to your body when you start walking 10,000 steps a day. 26. Touch and movement therapies. Meditation, mindfulness, and their cousins can help dial down stress. Remember, stress influences the gut microbiome and inflammation, and helps stabilize creaky joints, notes Dr. Blum. A review of 21 complementary therapies found that acupuncture, massage, yoga, and tai chi were most effective in easing OA and RA pain. Next, don't miss these 5 exercises that can help reduce arthritis pain. 27. Rheumatoid arthritis can raise your risk for cancer. Lung cancer, lymphoma, and multiple myeloma are more common in people with RA, partly due to inflammation and partly because RA drugs suppress the immune system. The link could also be less cause and effect, notes Dr. Marquetta. Smoking is known to increase the risk for both RA and certain forms of lymphoma, she notes. 28. Menopause worsens the symptoms of rheumatoid arthritis. A recent study of 8,189 women in the journal Rheumatology confirms something women with RA have long experienced: joint degeneration speeds up after menopause. 29. Getting a timely diagnosis can prevent permanent joint damage. In psoriatic arthritis, erosive joint changes can begin within 6 months of first symptoms, says rheumatologist Sergio Schwartzman, MD. But for many people, there can be a 5-year delay in receiving a diagnosis. A growing number of combined dermatology-rheumatology clinics may help reverse the trend. 30. Early arthritis clinics are showing great promise focused on treating rheumatoid arthritis patients with a recent diagnosis. Clinics have opened at the University of Rochester Medical Center, Oregon Health and Science University, and many private facilities. In one study, 89% of RA sufferers treated at an early arthritis clinic got disease-modifying antirheumatic drugs (DMARDs) in 3 months, compared with 50% who got care elsewhere. The clinic's patients had higher remission rates as a result. Those are just a few. But thank you for watching. Please like and subscribe.